Welcome back. A number of Nigerians are wondering how it is that late Liberian Patrick Sawyer managed to find his way into Nigeria even though he showed signs of having the Ebola virus. He died at the First Consultant Hospital in Obalende on Wednesday, August the 6th. And as a result of his entrance into Nigeria, it looks like Ebola arrived in Nigeria, and Nigeria has recorded about 2 deaths from Ebola, and there are signs that about 130 people are being observed, and 9 others have shown signs of having the virus. Now, to talk about the challenges in our health sector and how we are going to have to deal with this virus, it is my pleasure to welcome the Commissioner for Health of Lagos State, Dr. Jide Idris. Good morning.
Good morning. Pleasure from you.
And also in the studio is Dr. Demola Onokomaya, who is the Honorable Secretary, FCT Health and Human Services Secretariat. Good morning.
Good morning.
And thank you for joining us. Let me start with the Commissioner. It looks like all those who are coming into Nigeria are coming in through Lagos. So Lagos seems to be more endangered than other state capitals. How is Lagos State planning to tackle this visitor, let's say?
Well, first of all, I would just address the issue of attractiveness of Lagos to people. Obviously, the reason is very clear. It's in the nerve center of the country, both economically and politically. So everybody seems to be wanting to come to Lagos. Yes, with respect to healthcare, yes, we have a lot of things in place already, infrastructure, personnel, and what have you. However, I think in most of parts of this world, the preparedness for an epidemic, well, I must say, had not been really fully addressed. However, we have all those things in place, but putting them together as soon as this thing arrives, it's what takes time. Even in the countries where people are ready for this, it takes a while for you to set up that system to get it in place. And that's precisely what happened. In this particular case, nobody knew the nature of the disease of this guy. Because if that had been known, they probably would have quarantined him at the airport, not allow him to come in. And that's the major problem we had, because all the people who attempted to assist him, they formed the huge number of people now who have come down now with this disease. Right now we have...
Because they had no idea, did they?
They had no clue he had that kind of disease.
Oh, God.
So they did not take the necessary precaution to address the way, trying to help. Just, like reaction, wheeling a patient to a hospital. This one is dying, or something like you rush in just to do whatever it is you want to do to save it. That's what happened. And unfortunately, by the time they realized it, a lot of them had been exposed unknowingly before it was actually isolated when the full story came up. And this is what we're having to contain now, because most of the people we had now are people who had direct contact, who are closely treating him, that have come down with the disease.
Yeah, that brings the issue to the fore, that even medical personnel are endangered.
Yeah, basically for Ebola virus, the 2 cardinal cohorts that is at risk, number 1, the families, and number 2, the healthcare providers. So, but in this part of the world, our universal safety precaution model is a big compromise. Unlike in developed countries, for things like that, you see they're well prepared, they have a protocol. But because of the passion the healthcare professionals have, at times they allow that passion come in before being objective as a professional.
But doesn't this therefore mean that as soon as you enter your clinic, you are well kitted? Because you don't know if the person is coming in with typhoid or malaria or Ebola.
No, you are not. In a way, that will be counterproductive, because the patient itself, when they know that, they will not be happy. It will affect their healing process. Then 2, the family members and other people. You understand? But you should have a high index suspicion rate. You know, there are some cardinal symptoms, signs that can sell you out. So once you have these cardinal symptoms, first you do your basic preventive measures by, you know, before you take blood samples, you do your gloves, you wash your hands and everything. You know, your injection safety precautions to you put it should be at the peak. Then once you now have a high suspicion rate, then you can now isolate the patient. That's when the PPE comes into play, the personal protective equipment that involves the goggle, the gloves, the overall, and the rubber boot. But you know, just imagine if our patient is going to the hospital and doctors are dressing like that, I'm sure nobody will go to the...
Yeah, that will be. But one of the things that's being raised by quite a few people is what they thought or believe is the fact that if what happened with Patrick Sawyer had been a guy landing in Abuja, and you are the Honorable Secretary in charge of Health and Human Services in Abuja, the equivalent of the Commissioner for Health, if it had been in Abuja, they're saying that it would have been worse.
Like my boss said, you know, the problem is a case of information. Nobody knew he had that. And if you are conversant, right now in Liberia, you know, a state of emergency has been declared. Ideally, they should not have allowed that person to leave.
Ideally?
Yeah, ideally. That is the standard protocol. But right now, if anybody is coming, because of what happened, you know, the federal government, Ministry of Health, Ministry of Interior Affairs, you know, from the federal government, Port Health Authorities, the Ministry of Interior Affairs with the immigration people, they're having collaborative efforts. Because, quoting the Minister of Health, the 22 known borders in Nigeria, you know, we have plans on ground to detect anybody coming with Ebola. That's why they have this handheld thermometer scanner to pick up high fever, because that is an high index of suspicion.
Yes.
But what I'm driving at is, what is the state of preparedness of FCTA, the Federal Capital Territory area, that area that is the capital of Nigeria? What is the level of preparedness for this kind of thing? What are the procedures that you have in place? Everybody's commended Lagos State for what has happened, because if it was anywhere else, that's what they're saying, it would have been worse. It would have been spreading all over the place. It would not have been contained in this way. To the level where you had several governors from the southwest coming to discuss with the governor of Lagos, the most likely to pick his brain in terms of the procedure in place.
Okay, number one, I beg to disagree with you, because if that had happened in Federal Capital Territory, Abuja, I'm sure we'll have done better than Lagos State.
You think so?
Okay, all right.
Tell us what you would have done.
We'll take your word for it.
Tell us what you've got in place.
Then two, you know, in addition to that, for Ebola, the two cardinal steps is personal hygiene and massive sensitization. And sensitization in this place entails two ways, internal and external. External, the public. Internal, your staffs, healthcare professionals, and maybe people from the Ministry of Interior Affairs, the immigration staff, so that they should know what is expected of them. I know, like all other health challenges, if you know the determinants, you have the right intervention for you to have a brilliant outcomes. And the Federal Capital Territory Administration, under the leadership of Senator Bala Mohammed, we are very, very proactive. Because way back, even before Lagos State, sir, what we did, the first time we noticed the Ebola virus scare, you know,